Hi, everybody. Stewart Gandolf here. Welcome to our webinar. Again, I am pleased to bring an old friend and a new friend to our webinar slash podcast or article, depending how you're consuming the content today. Today, we're Rob Klein, one of my friends and colleagues and former Palm Springs modern mid-century aficionado is here to talk about research. So Rob and I will be talking probably about mid-century modern. We'll figure out how to put that into this conversation somewhere, Rob. And as well, we have a new friend, Chris Harrop with MGMA. He's going to provide some comments about some of the quick research they've done with their organization. He's Senior Editorial Manager for MGMA. But Rob will be doing most of the talking, and I'll be joining in with my usual color commentary. So welcome, both of you guys.
Thanks, Stuart. Glad to be here.
Thank you.
All right, great. So Rob, why don't we go through this? And you and I have prepped, and we certainly have a lot of thoughts about this. So let's just jump straight into it.
Sounds good. So just quick methodological background, so everybody is familiar with how we conducted the study. It was an online national survey among consumers, heads of household. We talked to a little over 511 to be exact, and we fielded this, which seems like moons ago, June 10th to the 15th. We all know things are changing almost daily as we get new information. So that's why this is the third wave of 3 waves that I conducted. The first wave was way back in April, early April, and then early May we did wave 2, and now we're talking about wave 3. I'm kind of watching what's going on to see if maybe a wave 4 might make sense, but I think what we're going to hear today, I think this really gives us some good guidance on the real question we have to answer as healthcare marketers is how do we get people back safely? We need them to come back, and they need us to help them to come back. And so we're going to talk about that. What does that relationship look like to help people come back to our organizations? So let's jump into the different chapters that we have in our study. First, this question I start out in the survey asking folks is, since we're so used to the bell-shaped curve now, that's all we hear people talk about, flatten the curve, flatten the curve. So people are kind of understanding that curve. So we decided to put that in the survey and say, where do you think we are on the curve? So you can see the first wave in April, people thought we were still ramping up to a peak time, the worst, if you will. Then wave 2 in May, we started just getting past the peak and starting down the backside. But then in wave 3, we kind of backed up a little bit. So really the theme of this wave 3 is hesitation. So this clearly is not going to be a linear progression back to whatever the new normal is going to look like. This is a windy, twisty road with bumps and blind spots, and that's the challenge. So I would say to you, people in this time period, they're very anxious right now. And when people are anxious, if you look at kind of sociology and psychology and consumer behavior, when people are anxious, their cognitive reasoning skills are diminished. And that means as healthcare providers, we have to do the thinking for them. We have to be there for them. We have to recognize they're forgetting things. They're not remembering to do this or that. So we have to help them through this difficult time. So not only do we have to have processes in place for access, whether it's virtual care, things like that, we have to help them understand how this new normal is working right now. That means we have to acknowledge their fears, and we have to explain how things are going to work. And we have to do it in a very calming, understanding voice, because how we act to them is going to signal how they should act back to us. And we're going to get into more detail on that. I'll kind of steal my own thunder, but I'm calling it empathic access. And you'll know what I mean when we get to those slides. I'll talk about it in more detail. But I wanted to kind of plant those 2 words in your brains today, empathic access.
So Rob,
also, as we're going to, yeah, go ahead, Stuart.
Just have to jump in at this opening stage here. It's interesting, when we talked about this offline, the idea of it going backwards in terms of where we are. And it's interesting, I read a lot, I wish I could remember the source yesterday, but one of the sort of smart people that was epidemiologist or I don't know if it was Fauci or somebody else, but was saying that, probably was not Fauci, that they're speculating that we are, at a stage now, and no, I think it was in Louisiana, that they're at a stage where they, the shutdown, where it's almost as if it didn't happen, right? So there's obviously a lot of coronavirus expanding. They're doing a better job of managing the cases once they get them, but clearly things are not feeling sort of like on the downward slide. And so what matters is that when I talk to clients about how to communicate with patients, and just really how to, communicate with staff and everybody else, is to have that long-term perspective. I think most people would agree that's, read any of the science on this, that this isn't going to be over by August. It's not just going to fade away. And so that long-term perspective, and I'm not an epidemiologist. I don't know when it's going to be over. My sort of stake in the ground is I'm hoping that the vaccines will be ready and rolled out in, early next year. And then maybe by May, we'll be in this whole new normal. But what's exciting about, and that's, I hope at least that, right? We're all hoping it's not done tomorrow, but I think it's important to have that long-term perspective of recognizing that, we're in, and I'll be writing about this more, but like healthcare is changing as we know it. But to have that perspective of maybe to settle down a little and recognize you can't be knee-jerk every 5 minutes, because it is a longer-term play, and your data, I think, will bear that out as well.
Absolutely. This is a marathon, not a sprint. And clearly, if we follow what the healthcare providers are doing, they're wearing masks, washing their hands, social distancing. If masks didn't work, then healthcare providers would be getting sick left and right, but they're not. So when I hear the argument of, oh, masks don't work or it's against my freedom, I say, if you're lost in the woods and someone knows where they're going, I would follow them. So I think we just have to follow the healthcare providers. They're clearly like, it works. Otherwise, we'd all be sick or dead. So I think that's something we've got to really figure out. This is a long-term play. So being safe about it doesn't mean we can't live life. It just means if we're going to go out, just be smart about it. Yep. The other thing that's important on this, that's a theme throughout the study, is that women and those 18 to 44, they are not as optimistic about our progress. They are more anxious. They are more concerned. All of their scores are more in the negative or worry range, if you will. And with younger people, gosh, many of them don't know a decade without a tragic event, whether it's 9/11, the depression, the recession of 2008, and now this. They're getting to the point where they're like, when's the next shoe going to drop? And so their mental health needs are through the roof. In fact, I think we're going to be facing a mental health crisis like we've never seen before. It's a lag effect. I think it's coming, but I think we're going to see suicide rates go through the roof. We're going to see opioid death. They're already way up. Divorces, bankruptcies, job loss. That's coming down the pike that I don't think no one's really talking about it and preparing for it. But the mental health crisis is going to be huge in this country, and we've got to start preparing for it now. So we also asked their exposure. This is an important question because there's a correlation between the more people that know someone with the coronavirus, the more anxious and their levels of concern are higher. So the more people that know someone, those are the folks that their concern level is higher. It's just like that old adage. If it's like, if I don't know anyone with this problem, then I'm not worried about it. Once it starts hitting home and I know someone with it, then all of a sudden the concern is real because it's at my back door. And so we're seeing the levels of people knowing somebody with it, whether it's friend or family, that's up significantly just in the 3 waves that we've done, hence our levels of concern. In terms of testing, testing is obviously it's going up every wave, no surprise there. And, fortunately, the majority of people are still testing negative, which is a blessing. But what's concerning is you've got many people that said, I tried but couldn't get the test. That's still 15%. That keeps going up, 8, 11, and 15. So what is of concern is not that more people are getting tested. That's a good thing. But more people are trying to get tested and they can't. That's more of what concerns me. So let's talk about some of the behaviors during and after the coronavirus. We asked folks, and I apologize, I should let you know, at the bottom of every chart is the actual question we ask in the survey. So if you're curious, hey, how'd you ask that question? It's at the bottom for you. So we asked folks, did you have any new healthcare behaviors during the coronavirus. And the dark blue bar is wave 3, middle blue bars is wave 2, and then the lightest blue bar, that's the first wave. Remember back in April and May were the wave 1 and wave 2. And you can see the arrows, those just indicate a statistically significant difference between those two data points. So for example, virtual mental health, that 11% is significantly higher than in prior waves. The same for virtual visits. So if you look at just those two things, and we take nothing else away from this study, the two big things that are critical for us is virtual care is here to stay. We've got to be on board, not only operationally, but how we're positioning it. And I'll talk a little bit more about that later. And mental health, whether it's virtual or in person, back when we get to our new normal. But mental health capabilities are absolutely critical for us. You know, we want to be able to take care of the whole person, and population health, we talk about it as providers all the time. Well, now it's been thrust upon us. Now we really do have to manage entire populations. So then we also said, whether you've done it now or not, how likely are you to do it after the coronavirus has ended, whenever that is? And so these are the percentage of people that said, oh, I'm definitely going to do that. No surprise, PCP office visit. People want to get back to normal. If they were seeing their doctor before, of course they want to get back to seeing them. No one is saying that virtual visits are going to replace an in-person visit. They are just augmenting it. They are another option to expand access to care. Because I can tell you, time is the new currency, and access is critical now for consumers.
So, Rob, I want to expand upon that.
Yeah,
so one of the things that we talk about again is we look at the future and how healthcare is, jumping ahead to May-ish or whenever, that healthcare is going to change. And I think that the thing that's interesting is exactly the way you have your slides out here is the PC visit is certainly still key, but urgent care is part of that process. Retail clinic is part of that process. Virtual visit is part of that process. So, just like with our webinar, we deliver our webinar, you can read the transcript, you can read the summary, you can watch the webinar, you can get the slides, or you can listen to it on a podcast, right? Different people want to consume information differently. And so we give the people what they want. And healthcare, I would argue, is the same way. That, and the other thing that's we can talk about is relevant to your survey here of how consumers have embraced virtual visit. There was some trepidation from people, certainly reimbursement, we've talked about reimbursement barriers, HIPAA barriers, doctors not wanting to do it for a whole bunch of different reasons, but the consumers are coming back. And as we think about the future, we're trying to think through, okay, we have to get slogged through these very difficult months to get to the future. But I would encourage anybody on this webinar to be reimagining your business with these components as part of how do we deliver care? How can we make it easy for the consumer? Because healthcare, there's all kinds of friction in the healthcare process, legendary friction in the healthcare process, but clearly when the consumers are voting with their feet. So that's really intriguing how broad of interest there really is here.
Yeah, and it's all about primary care. And as you say, we still want to have a primary care relationship, but that how we interact with that primary care or sick care or urgent care, there's more access points now that we have to provide to people. It's not just going in to see my primary care physician like it was in the old days. Things are definitely changing with that. And with virtual visits, I mean, I was in banking in the early 80s and did a lot of research when ATMs were brand new. People did not like ATMs at first. They thought they were going to make mistakes. There was no one to talk to. And nowadays, think about this. Can you imagine a world without an ATM?
For sure.
No, you can't. So eventually, people are going to be saying, oh my gosh, can you remember a world without a virtual visit? That's going to come. We have to help people get there because some of the concerns people have about virtual visits, they're the same things I heard back in the early 80s in terms of lack of quality, lack of privacy, things like that. So people sometimes buck new technology and then they realize, oh my gosh, what did I do? How did I survive without this? So we have to help them get that way with, say, virtual visits. And then mental health sessions as well. Those are critical, especially among younger folks and women. Women are the household CEO. and the healthcare decision maker for the vast majority of households. And so they're seeing firsthand what's happening. They're paying attention to what's going on during this time, and their stress levels are higher than men. So how did, this is my added in the third wave here, how did consumers first learn about virtual visits? Well, their doctor's office. So physician offices must continue to be proactive in offering solutions to get patients back in. Clearly, physicians are the face and voice of healthcare brands if they're part of a healthcare system or employed by a larger organization. In many ways, they are the 5th P of marketing. You know, we learn product, price, place, and promotion. Well, they're personal selling. So we've got to make sure we provide them with all of the resources and the learning so that they can be that brand voice for our organizations. They are critical. You know, Chris, if I can ask you, you know, with your work, are you seeing the kind of the same things that physician offices really are at the front line right now, and they are representing the brands behind them in many ways?
You know, something that keeps coming up is just how you allude to it and how many people know someone that has COVID-19 and how there's a lot of uncertainty and anxiety associated with this. Doctors and nurses are 2 of the 3 top most trusted professions in America, according to Gallup's polling. So they have a very good bully pulpit right now to go out and be trusted voices to say, look, we're on top of this. We are a safe place for you to come. But if you are seeing patients that are very apprehensive about leaving their home, going to places indoors, they have to be at the forefront of communicating that. And that we've seen a lot of practices that say, you know, okay, we got to reschedule. We're gonna take the effort to make those manual phone calls to reach out to people individually, because we know that people are so anxious. They want a human voice to let them know we're still here for you. We still have that relationship that we want to maintain with you. And there's this big population health concern that you alluded to, the potential for isolation leading to mental health concerns exacerbating, like suicide or substance abuse issues getting worse, such as opioids. I just want to come back to that. It's like, I talked to one practice leader who was working in GI in 2008 during the Great Recession. And, you know, something that happened then was they started thinking of colonoscopies, the screenings for colonoscopies, as elective. That is really dangerous when you start missing some of these really crucial screenings that can either happen in the primary care space or some of the specialist spaces. Those need to still happen, whether you get someone in by a virtual visit or you communicate to them that they do need to come into the office if there's a physical exam that really doesn't lend itself to a virtual visit. So those are really important things for physician practices and other healthcare providers to really be proactive in communicating that. And as you said, be empathetic.
So actually, since I know we're going to have to race through some of these slides, but to jump on or to add to perhaps both of these comments, you know, there's a study that we've covered in past webinars from McKinsey that shows that patients, the biggest thing to get them back in is you have to ask them. So it's, I think it was 54% of patients said, well, I'd go if they'd ask me. So it's amazing. So Chris, exactly what you just described is get on the phone and call them. And so at the practice level, and we have listeners here from great big health systems with, you know, 100 different hospitals or more, and we have private practices as well. And then, so the big hospital and health systems, it's harder because you have to scale up, but the concept is the same, right? It's, you know, we ask them. And that's really, really important. We'll talk about the safety issue even more, but the fact is you have to figure out a way to ask them. And then also just anecdotally, it's interesting, my wife has a couple different doctors in her orbit, and one of them is a cardiologist. And so recently my wife was calling to cancel, and they said, well, do you have FaceTime? Great, we can do the appointment with you now. So that's, you know, it's easy, less friction for the patient, now billable because it was FaceTime with the cardiologist, right? So having that sort of attitude of how can we adapt to a new reality, and you know, the whole FaceTime, that'll probably go away soon. I'm not sure where we are with that. I know that's the HIPAA protection part of that was the beginning of the pandemic made easier. But in any event, the idea of pivoting and delivering care in a new way is really crucial. All right, Rob, I'll let you go. Take it back
Great.
over.
So then on the flip side, if they didn't have a virtual visit, we said, well, why not? And here gets at those reasons that I mentioned earlier. You know, it's too impersonal. I want to see the doctor in person. Simply, I just don't know enough about it yet. Or I don't trust the quality of care. I'm concerned about online privacy. Again, these are all perceptions that we can counter with the proper messaging. I know I've got one client that they're offering the first virtual visit free when you're healthy. They're like as a practice, just come on, let's get on together. We'll show you how it works so you're comfortable so that when you really are sick, you know how to use it. You're not using it the first time when you're sick and you know, when you're not feeling well. So I thought that was a brilliant idea. The bottom line is we have got to think out of the box right now. We've really got to be creative in what we're doing to help people. So this is kind of the one question that's not specifically healthcare, but it just shows where people's minds are at. We ask them all of these different activities. Do you think when things are over and you can go back out, do you think you're gonna do these things immediately, maybe after 3 to 6 months, or you're not sure you're ever gonna go back? Here's where I brought the word hesitation. It really is creeping back into people's minds. The red in the immediately, all those red percentages mean that that score is down significantly from prior waves. So that means less people said immediately in wave 3 than in prior waves. So people are starting to step back and say, you know, maybe I don't want to eat at a restaurant or go shopping or go to the gym or even a place of worship. So people are they're kind of stutter stepping a little bit and saying, no, maybe not. Hugging and shaking hands in social gatherings. You know, we're human beings. We love to hug and shake hands. We've been doing that since, you know, the beginning of our time. So how is that going to change us as a species? That's really has a huge impact on just us as human beings. So again, this is where I'm talking about hesitation is creeping back in just a little bit. So the key thing is, how do we get patients back in? So we asked folks first, what did you have any appointments or procedures you had to cancel? And so the good news is the number of, or the percentage of folks that said I had to cancel is down a little bit. You can see here that it's gone back up, that I didn't have to canceling any of these. So, but still the majority are canceling appointments. So we're going to have a lot of folks that have to come back in to get caught back up. So we've got to be prepared for that influx. And that means we've got to be creative on how, when, where, and with whom. So we're going to talk about those in just a minute. So we asked folks then if they had to cancel an appointment or a procedure, what did you do? And the first thing they said is, they could have said is, I rescheduled, or I'm waiting. I'm not, you know, I kind of not sure I want to go in yet. I tried to reschedule and they wouldn't let me, or I'm not going to reschedule. I'm going to just forget about it. Or I was able to change to a virtual visit. Again, percentages in green is up to prior waves, and red means it's significantly down. What's most concerning to me on this is the mental health column. You can see here, you've got 40% of folks that had a mental health session canceled. They haven't come back. They're not getting care when they probably need it most during this time. So how do we all know that if it's hard enough to get in the first time to seek care, if you're having a mental health challenge, and it doesn't take much to kind of have you say, you know, never mind, or I'm not going to go. We have really got to do a better job of keeping people that are already seeking care and making sure that they stay with it. And then how do we get new folks in? So if we've gone virtual, I know a lot of psychologists are saying, I'm all about virtual visits, but only with established patients. I won't start out with a new patient virtually. I need to see them in person first. How do we handle that? So there's a lot of things we have to be talking about so that we're prepared, so that people don't go on suffering. A new question that we also added, what medical conditions are you in immediate need of to be seen right now? And look at the top ones in the darker brown bars. They're mostly mental health related, stress and anxiety, depression. hypertension, headaches, migraines, weight gain, trouble sleeping, drug or alcohol abuse. So nearly 6 in 10 adults have some immediate health need. Again, when you multiply that times our population, that's a lot of people that are in need of care, and many of whom are not able to get it. And much of that care is mental health related, not a pure physical related need. What would make people switch providers? So we asked folks, pick, which of any of these would make you switch providers? And then I kind of coded them, if you will, into, or categorized them into attitude, safety, access, health, and cost. And so attitude is key. Remember earlier I talked about empathic access. Well, not only do you want to be able to provide access for people to come back in, all of us, whether it's the physician, the nurse, someone from the call center, someone from the physician's office, we all have to be part-time therapists when we're talking with patients. We can't just say, yeah, we'll get you next Tuesday. We have to say, I know you're struggling, Rob. I know you're concerned. Those are legitimate concerns. Tell me more how you're feeling and how we can help you. Here's what we're doing to help get you back in to receiving care, and how we're going to do it safely. And does this sound like this would work for you? So it's acknowledging their fears and then telling them what we're doing to make it safe for them. Look at the number one thing. My current provider lacks empathy for my situation. They had a negative attitude towards me. They seemed rushed. This is not the time to be doing that. We have got to be empathetic as well as providing access. Stewart, we're going to add something?
Yeah, Rob, it's funny. I'm just going to interject. My colleague, Kathy Gordon, is now at this exact moment doing a webinar. We're doing a lot of webinars these days for the Community Oncology Alliance. And one of the things we talked about as we prepped for that meeting was this whole idea that now that you're slower, what you can do is some of the things that you've been meaning to get around to for a long time. So just like you were talking about the empathy right there, when you're answering the phone and you have people are scheduling for appointments, and you always really wanted to give them a great experience on the phone when they came in and to make them feel reassured they're going to the right place. But this would be a time, especially if you're less busy, to really work on developing those muscles and getting really good at it. You need to today anyway, right? Patients need to feel like you're being empathetic and you understand the situation. What a fantastic opportunity if you ingrain that in the culture of your hospital, your center, your practice, or wherever. That's just part of how we do things going forward. And so that's a topic for another webinar. I can't go into that for the sake of time, but those are the kinds of things we can think is like, what kind of opportunities can we do to improve our business that could be habits for the long term?
Yeah. And safety was lower down prior wave, but it's creeping back up. And I think a little later in the study here, Chris will talk a little bit more about some of their findings and the importance of safety. So I'll tee that up and we'll get to that in a little bit. But just know that, not surprisingly, as hesitation and concern, we saw in that bell-shaped curve, people are kind of stepping back a little bit. So it's no surprise that safety is bubbling back up to the surface.
Hey, Rob, really quick, just to build upon that, there's a lot about how practices are responding that add more patient-centric workflows into all of this. So much of how doctors' offices were scheduling before was provider-centric. When is the doctor available to see someone? And you got a batch of patients in the waiting room, and there's a certain amount of wait time. Now, as we're seeing, people are eliminating the wait room altogether. They're doing mobile check-ins from their cars outside. You are now seeing a pull system for patient scheduling that is more focused on making sure that when the patient is there, that we let them know when they can come in, and then you walk someone from the door back to the exam room. That is a tremendously different culture of your workflow than what we saw before. So there are some patient-centric changes afoot that are only going to help you be more empathetic and seem more invested in the relationship with that individual.
Great. I would love, Chris, I'd love to talk about that another day, because just don't get me started on those things. But I think it's great that you're seeing that at the practice level as well, because I famously have whined about my mother being made wait an hour and a half to see a cardiologist once, because that was good for their schedule versus hers. And it's, so we've been talking about patient experience a lot with our podcast here. So that's great to hear that. We'll have to talk more about that another day, for sure.
Yeah, and I've always told clients that a waiting room is a brand experience failure. It always has been, it always will be. And now what's happening is, out of this difficult time, good things are starting to happen in terms of we are becoming more patient-centric. So we unfortunately needed a pandemic to have us get off our keisters, but that is key. And so making things customer-centric, if you will, is critical. So those are great things. Again, I agree. Topic for another time.
Yeah, well, you just get an opportunity to reinvent yourself in every way. And this, again, that's not today. I'd love to talk more about it.
Absolutely.
But go ahead,
Yeah.
Rob.
Well, and as again, I put my quote up there, time is the new currency. You can always make more money, but you can't make more time. And healthcare has been notoriously effective at wasting people's time. And that no longer is going to fly. We don't even have time anymore. We don't have time to kind of lounge around. We're so busy just trying to get people caught up. So efficiency in every step of the patient journey is paramount now. Level of concerns about seeking non-coronavirus care at these facilities. I added this question last wave because I was seeing more and more people on the news saying they weren't going to the ER when they were having heart attack symptoms because they were afraid to get the coronavirus, and then they were dying at home. I know there's been a lot of PSAs, the big one that the Boston hospitals did a while back. If you're having stroke or heart attack symptoms, you've got to come into the ER. We know it's the safest place to be, but it's amazing how many consumers don't. I have a client that their high-risk moms were trying to deliver at home because they were afraid to come into the hospital, and then they had to be rushed to the ER because they had complications which were anticipated early on in the pregnancy. That's why they were deemed high risk, but they changed at the last minute and tried to deliver at home, and some serious things happened with this client's mothers. So it's those things we have to counter over and over. We can't over communicate enough. We are a safe place to be. This is what we do. Fortunately, the concern levels are down slightly from wave 2, so they're not increasing, which is great. The problem is they're much higher among women, 18 to 44, as well as among the African American and Hispanic communities. We know that especially the African American community is getting hit harder with the coronavirus. So their concern level is absolutely legitimate. And it just shows you we can't communicate. One size doesn't fit all. We have to be more targeted with our communication and our messaging to empathize more personally with a particular group's fears, whether it's gender or age or ethnicity. It doesn't matter. Whatever that is, being more empathetic to their specific concerns is critical. So here's some things. If people are willing to make trade-offs. We talked about how do we get people back in. Here's the where. Almost a quarter of folks said, look, if I've got an inpatient procedure, I'm cool to have it done at one of your outpatient facilities if I can get in faster. So you've got a quarter of the people are willing to change up where, and that opens up your opportunities for getting people back in faster. And then the type of provider they would see. And Chris, this is probably interesting to your group. About 1 in 5 are willing to see an advanced practitioner as opposed to their primary care physician. So nurse practitioners and PAs, they play a vital role in helping to get people back in. Chris, what are you seeing within your group in terms of how the advanced practitioners are working with the doctors?
The importance of APPs and your nurse practitioners, your PAs, has only gotten increasingly more important every single year, even before COVID-19. It's just to maximize the amount of time that your physicians can actually spend on care. And of course, there's a lot of things on the administrative side that are taking up more time. Getting more of your nurses involved in this and everyone outside of your physicians, they still have critical roles to play, even though in the very early months of this, I should really say early weeks of this, there were a lot of furloughs in some physician practices, but now that you're getting those volumes reestablished, that you're back perhaps around 75% of pre-COVID normals, maybe even closer to 100%. We're seeing some practices actually getting that mix of in-person and virtual visit back to about 100% of normal volume. They have a critical role to play. And you also have to consider the pre-visit workflows for those virtual visits. Someone still needs to get those charts in front of the doctor so that they can look at it before they talk to the patient. That time that the doctor has with the patient in a virtual visit is very valuable. As you say, you know, time is the new currency. You don't want to waste that time in that virtual visit just figuring out technical stuff. You know, a lot of the practice staff are also being involved in making sure that everything goes off without a hitch before that virtual visit. So they are definitely very important, and it's important for a lot of these practice leaders to make sure that they are getting their people working to the top of their licensure to get the most out of them.
Yeah, great, thanks. So next few slides are, what are some things that we can do to ease concerns? So for safety, people are catching on of what we've been teaching them: social distancing, masks, wash your hands. This is what we've been teaching them. It's not like there's 50 million things that we can all do. These are the top 3, and they work, as I alluded to earlier. Wear your mask, wash your hands, and social distance. So they want to see us doing that as much as we're telling them to do it. I had a client that had a PSA, and the physicians and nurses weren't wearing masks because they said it muffled them for the video, and it was panned. And so I said, you got to start over. People were saying you're being hypocrites. You got to walk the talk. And they're like, you know what, we screwed up. And so they reshot the whole thing. So luckily they tested it and it didn't go out live. So it's things like that. People are watching what we're doing. And so we've got to make sure that we are walking the talk. When it comes to cost concerns, I know some of these you can't legally do or not always available to do in different states, but I threw all of these in just to think outside the box. The bottom line is consumers want healthcare providers to at least acknowledge their financial strain. And if those that are really in serious financial need, what can we do to help them? Is it extending payments, giving them a payment plan? Is it waiving their deductible? Things like this. I know we're the providers, you're hurting financially. We all get that. But we've got to prime the pumps to get people back in. So revenue has to start before profit. So think about when you start a cold car. You can't rev it right away. You'll blow it. You've got to let it idle and warm up. That idling is revenue. The revving up is profit. We've got to be smart about this. We've got to get people back in. And if that means we have a segment of our patients who are really struggling financially, we have got to come up with some ways to help them. And then on access concerns, virtual visits, again, doesn't matter how we ask it, that keeps bubbling to the surface. The other thing that's interesting that I've noticed, I do a lot of access research outside of the coronavirus, and extended hours during the week, that always came up above weekend hours. So if people have their druthers, they would rather have you have extended hours during the week, early morning and late night than weekend. Now, given the time we're in, and we've got so many people to get back in, we've got to be all hands on deck. Bankers' hours have to go away. And so we not only need extended hours at night, we also need weekend hours. So eventually over time, when we're caught up, maybe we pare back on the weekend hours, but weekday hours are absolutely critical. Again, working in banking in the early 80s when bankers' hours was the negative, you know, no one ever said that positively. That was kind of a snide remark. Oh, you've got bankers' hours. Well, now we've got, oh, you've got healthcare hours. We have to get rid of that just like banking did. And that's where access comes into play. Access got rid of bankers. Yeah, go ahead, sir.
Interject. If you're working 9 to 5, that's your hours, you're closed 76% of the time. Just as a reality check, if you think about it.
There you go. Nice stat. Yep. And then what's the preferred method of communication? It's twofold. Phone, verbal, so you calm their anxieties, but written, because there's so much for them to remember. Remember, they're cognitively impaired. So if you get on the phone and say, oh, you need to do, and we're going to do A, B, C, D, E, F, G, they're going to forget that by the time they hang up. So you've got to talk with them about their options and empathize and acknowledge their fears. And then you've got to follow up in written communication. The bottom line, as Chris and Stewart were saying earlier, it's about being proactive. The days of being reactive, you know, we build it and they will come. Those are gone. We have got to go out and we've got to bring them back in. Preferred messaging. Patients get the drill. It's about explaining what to prepare, explain how we're handling things. That's really what it's all about. And it's about what we're doing now, not what we're working on doing. I went back and watched FDR's first inaugural speech back in the 30s, and he talked about basically Americans, they want action and action now, because he was trying to get them out of the Great Depression. And that's what Americans want right now. They want action, they want action now. So whatever your messaging, it's got to be, here's what we are doing now. Don't get into, here's what we're going to be doing. And I'll tell you too, we didn't test for this, but other work I've done, this, we're all in this together, stay strong. If you're doing any of that messaging, stop. And this is a marketing term that I just made up. They're getting sick and tired of all this kumbaya crap. So stop all this feely stuff. They want to know, what are you doing? Give them action, because this, stay strong or win this together, it's like an intransitive verb. It has no action. So remember that in your messaging. Your messaging should be like an action verb, not an intransitive verb. So there's my English lesson for the day. But you get what I'm saying there.
Yeah, the messaging, I think, needs to be relevant to the today, but moving forward at the same time. So it can't be out of touch, like you just described. But so it needs to be relevant. But people are, they have COVID exhaustion at this point. So at the same time,
Sure.
Ignore it. So it's a really fine line. But yeah, for sure, we're all in this together. And if you kind of look around the country, you're not seeing we're all in this together. As we're going through some stressful times, for sure.
So perceptions of how organizations are providing. So provider side, my doctor, my preferred hospital, significantly more confidence in how we are handling things and making them more confident to use them in the future. Prescription, pharmaceuticals, retail clinics, and health insurance companies, not so much. Health insurance companies, they're making bank right now. They're making a lot of money on monthly premiums. They're not paying as much out because they're not getting care. So I wonder what their brands are going to be like when we come out of this, because what we do now will be remembered. So how you treat people now, they will remember that. So your brand right now, as Chris says, you're the heroes, and that can set you up to come out with momentum, or you can come out facing headwinds, which will be very hard to combat. So how we treat people now is absolutely critical. From a PCP, about 8 in 10 people nationally have a primary care physician. That's pretty consistent, I see, over my other studies. And we asked them, what kind of job are primary care physician, is your PCP doing at patient care during the pandemic? And you can see that it's pretty strong, making you feel safe, proactively communicating, keeping you informed, providing alternatives, recognizing our heightened emotions. So primary care physicians are doing a pretty strong job at doing all these things, which is key. And then, Chris, if this is from a recent study you've done, if you want to talk to this and maybe any other data.
Absolutely. So MGMA does a weekly SMS-based polling initiative called MGMA Stat. And we have a panel of a couple thousand practice leaders that we talk to every week. This most recent week, we asked, what was the top reason that patients are giving you for deferring care? Why aren't they coming into the office? We just did another poll recently assessing where the payer mix changes are happening. We know millions of people are out of work. There are going to be continued unemployment claims for months to come. How much is the issue going to be loss of job and insurance versus just the main existential threat of a pandemic? And 87% say safety is that concern. It's not so much that they're worried about how to pay for it. There's certainly an impetus for people to be concerned about talking to your patients about how they're going to pay, getting some sort of payment arrangement set up. But safety is number one still. I mean, other people cited that, well, you banned elective surgeries in my area, I can't get that seen. Or patients are unwilling to comply with safety regulations. They don't want to wear a mask, or they're of the opinion that the pandemic is exaggerated or a hoax or something like that. There's actually a small segment of the population that we saw, they don't like the fact that there are visitor restrictions in some clinics, that they definitely want to have a family member or someone else with them when they go to see the doctor. But by and large, safety above all else is what is going to be the key determinant of getting people back in. And that just speaks to the need for meeting people where they are. You need to have a proactive approach for your virtual visits if you're not going to be able to convince them to come back into the physical clinic space. People, there is that fear out there. And
sure. I'm sorry, go ahead.
You know, it's at least, you know, all these people they're still a little bit scared. And to Rob's point earlier, there are people with chest pains, there are people with drug symptoms, gallbladders are inflamed, and they're just staying home out of fear. And so that is a crucial element for people to understand. Communicate how you're keeping them safe, that they are safe because their doctors and nurses and other employees there are safe. But if you don't want that, we have another option for you.
One of the things that this is a topic that, you know, a lot of hospitals we work with, and, you know, certainly there's a lot of hospitals out there with marketing departments that are the same message of safety. And so we have to get patients back. Clearly, we know if we're on the hospital side, you know, elective care is where all the money is. We're not doing elective care. That's a real problem. But the interesting thing that I would say is that every, you know, whether it's a practice level or the hospital level, you know, it's brainstorm every inflection point you can. So do you have videos with providers, you know, assuring safety? Do you have emails and texts assuring safety? How do you answer the phone? Do you ensure safety? What kinds of things that are tangible and physical that people can see? So for example, my wife had a procedure right as soon as things opened up. She moved because we were worried we'd get a second sort of bounce up here. And so she went to an ASC, which made her feel more safe. It wasn't where they're treating those COVID cases. She waited in the parking lot till they were ready. They, you know, wheeled her out to me. There were no visitors. All those things and communicating that. And the last point I would make at whatever level, whether you're, you know, a hospital, health system, or a practice, you're going to get sick of this message way before patients do. That's a really common trap for marketers, is they get sick of talking about safety, safety, safety. We said that already. It's like, no, you haven't. Not enough. It's, you know, it's spit in the ocean, so to speak, in terms of, like, you know, there's a lot of people competing for the mind share. And then I think that going back to something, Chris, you mentioned earlier that we've written about, and probably should talk to you guys about more, of making the the providers the voice of reason in the community, and taking advantage of the bully platform they've got. So yeah, that safety thing is just say it and say it and say it again.
And you know, if you are extending weekday hours or even weekend hours, you know, that can help you underscore. It's like, well, we're extending hours not because we need to get revenue back, which is very much the case for many of these practices, but it's also, well, we're rotating our staff so that we don't have too many people in the physical building all at once. That extended hours and rotation of staff are a social distancing strategy for your practice that can further help you help your patients feel like they are going to be comfortable coming in. Okay, there's not a bunch of people in the waiting room. There's not as many people milling about. That limited exposure for them can be a selling point to overcome that hurdle of, I'm worried about my own personal safety.
Yep, very good.
Yep. Another interesting finding here is that we asked folks for coronavirus information, what websites of social media did you look to? And no surprise, the CDC, that's still the number one, but it's down significantly from prior waves. And what's up from prior waves is the doctor's website. So again, the physician's role in informing patients and helping them come back in is growing. And no matter how we frame the question. So I think that's important as another way is how are we getting people to our places of information, whether it's our social media or whether it's on our website. How are we getting people in? So, you know, you're talking SEO, SEM, things like that. But the important thing is doctors' websites are increasing as a place where people go for information, as well as one that's most useful. I know, Chris, as you were saying earlier, that physicians and nurses are the most respected occupation. And so how are we helping them to really become that strong voice?
Yeah, absolutely. The Gallup poll that I alluded to, I just want to medical professionals in general rate highly in Americans' assessment of honesty and ethics, with at least 6 in 10 US adults saying medical doctors, pharmacists, and dentists have high levels of these virtues. I mean, we already have physicians that are very well versed in the bedside manner. It's like they should be able to reach out to the patient consumers and really be that voice in this cacophony of politicians, of things that they're hearing from corporations and other businesses, whether it's national, local. The doctor has always been a trusted source. Going back to the Hippocratic Oath, it's like, we understand these people to be trustworthy and knowledgeable on this. Let's take advantage of that. And, you know, take a look. I'm really interested in seeing what the Los Angeles systems, what they've been doing, what kind of results that they get from the efforts that are going on out on the West Coast, so that they have a joint effort right now that's saying, you know, your life may be on pause, but your care isn't. That is that is a potentially very strong message coming from a physician.
Yep, very good.
Yep.
I want to take just a moment here of time check. I can go long because this has been very, very meaty. We will be having some questions and answer period at the end of this. We're already 5 minutes from the hour. Rob and Chris, are you guys okay going a little long?
Sure.
Good, okay.
Absolutely, absolutely. Fortunately, we're coming to the end, Stewart, but.
I'll text my team. They're going to wait for me. I have an internal meeting I'm going to be late to. And then for those of you, any of our listeners have a hard stop at the hour, that's fine. There will be a recording, so you can catch the rest of this later, and slides will be available on the website. So let's just keep going.
Yeah. So the last section here, the emotions Americans are feeling. Fortunately, the level of loneliness, anger, fear, and anxiety is coming down. Hope, optimism, inspiration, it hasn't changed. So, but some of the negative emotions are coming down. However, they remain significantly higher among women and younger folks. As I mentioned, that theme is consistent throughout our study. But I also went back and took a look at the emotions of healthcare workers. We asked folks if they were a clinician, you know, or if they worked in healthcare but they weren't patient facing, or they didn't work in healthcare. So here's what's concerning. The dark blue bar is our frontline clinicians. Their levels of loneliness, anger, fear, and anxiety are not only significantly higher, but just dramatically higher. Like on a 0 to 10 scale, they're 2 rating points higher, which I just don't see very often in any other studies that I do across different subgroups. That is huge. So you know, what are we doing as an industry to help our frontline caregivers get through this emotionally? They're exhausted. I've seen more than one physician break down and cry when they were giving they were doing a press release, so they were talking to the press. So they're worn out. What are we doing to help them get the emotional support that they need? Fortunately, their optimism is much higher. And again, every one of us knows healthcare clinicians, and they are an optimistic group. Otherwise, you couldn't make it in being a caregiver. But I do worry about their emotional levels. We've got to take that and treat the whole person like we're talking about with patients. Chris, what are you guys seeing along those lines of that emotional stress?
It really is important for anyone in a leadership capacity in these healthcare provider organizations to address their providers and staff. Let them know about the available mental health services that are available to them, either through their commercial insurance plans, EAP, things like that. Make sure that they understand that you are thinking of them, and then take a look at what are your workplace policies for leave and disability, family leave, things like that. And just demonstrate that you're committed to the mental health of them as employees and workers within the organization, because you're going to have to rely on them to communicate to your patient base those same things, that yes, we are all dealing with this very stressful situation. People talk about the COVID-19 pandemic. It's not just this, epidemiological disaster, but it's also a crisis of isolation, as we've talked about before. So if you can communicate and train your employees and your providers to talk about this the right way and to assess themselves, they're going to be in a better position to communicate that to the patients. And that's going to reap really good benefits.
Great. So the key takeaways, we've already walked through all of these, so you can read them on at your leisure later. But I just wanted to leave you with this last slide before we take questions and answers. It really is the path back. What are the building blocks? And access really is about where, when, how, and with whom. But it also has a foundation of attitude. How you accomplish the what will make all the difference. Remember that empathic access. I started out with it and I'll end with it. That empathic access really has to be our mantra going forward and really drive all of our innovation. So it's not just about having virtual visits operationally, it's about how do we get people scheduled for that, being proactive and empathetic.
Very good. I guess,
Stewart, do you have some final thoughts?
Yeah, I'll just say that again, as you were talking through this and looking through your slide, it's just so important to recognize, and it's inspiring to me that healthcare can be better. I love some of your comments, Rob. Some of our favorite podcasts with you were just sort of offhand things that we've discussed. And I love the waiting room as a brand, as a leading example of a brand experience failure. So I feel like that this is an opportunity that for us to stop and really think, okay, we have a new world. Healthcare is transformed forever. These things like no more banker hours and virtual visits and letting people wait in their car, building a system around the patient is really fundamental. And we've even had on other podcasts, therapists talking about, and one of the therapists I know talks about how, will I have missed it? Like, once this is over, let's pretend it's all over. Would you be mad at yourself for missing the opportunity this presents? And that's really an intriguing thought. If suddenly it got somehow, luckily, to be prematurely over, this will be over eventually. So from a standpoint of, patient-centric care, how do we build a patient experience? And long-term subscribers and readers, listeners will have done a ton on patient experience with our podcast. And, it's always been sort of, well, it's a system and it's really hard, and it is. But another thing that last year at SHSMD, one of the speakers was talking about, because he was from the investment world, and the hospitals would say, well, we can't really do that when it comes to making the bills transparent. Well, we can't do that. And, offering multiple points of access of care. Well, we can't really do that. Sorting through the insurance issues, we can't do that. And when the money guys are saying, that's exactly what we're counting on. Because we're going to swoop in and disrupt this marketplace. And while you're telling us why we can't do it, we're going to find ways we can. And that's really what's happening. Look at all the retail clinics coming across America, right? CVS and Walmart, they have prices posted when you walk in. They figured out how to do it. So there's going to be disruption. Which side of it will be? And maybe another thought, this is funny, socially, I know somebody was saying, yeah, my doctor said, as soon as this is over, I'm dumping this telehealth. And my sort of macabre joke is, there's Teladoc behind you going, yes, that's exactly what I hope you're going to do. So, it's, the world has changed. You can fight, you can complain. Another thing that we did recently was a podcast with my creative director about the stages of grief, right? You can stay in denial forever, probably not the most effective strategy when you go through the Kubler-Ross model, right? Let's get to acceptance as fast as we can and rebuild towards a new reality. So that's a lot, but I think that's just what this is. It's like, for all the devastation and death and, suffering and, problems we have right now, it's like, okay, can we at least get something, a silver lining out of this better? Can we make healthcare better together? So that was terrific. And you guys are colleagues in arms here. So Chris, it was fun having you here today, and Rob, fun as always. So we'll have to do this kind of stuff more.
Thanks, Stewart.
This is a tremendous opportunity for reinvention. People, so many practices that I've talked to, they were looking at telehealth before, but there was just the barrier of regulatory mandates that prevented reimbursement. You take that away, they jumped on it. There have been just too many stories to count about just rapidly launching into this after people had been looking at it for a long time and just waiting to pounce on it. Let's also think about, it's not just about reinventing the patient process, but also what does your physical space look like? If you've sent home billers, coders, and all sorts of other administrative workers to work remotely, does that really come back, or does that just become that new normal? In which case, you have a tremendous opportunity to reinvent your practice space and say, maybe we get more clinical space that can be revenue generating. There's tremendous opportunity here. And the right mindset being, having that perseverance to say, we're going to do this rather than just say, we're going to get through this, will probably make the difference for a lot of these practices.
If you have any questions, we are over time. Feel free to send an email back to us or communicate to us at healthcaresuccess.com. Chris, Rob, fantastic discussion today. Thanks for joining us.